See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
The American Nurses Foundation commissioned the first study of nursing and philanthropy.
The thing that really stood out for me in the report was that only 1 penny out of every dollar from a philanthropic perspective was going to nursing.
1 penny of every dollar. How could that possibly be?
The report is shining a light on the risk to us all based on the lack of investment in nursing.
The economy rests upon healthcare. If you do not have a strong healthcare system, the economy falls apart, and the healthcare system stands upon the shoulders of nurses.
The key to solving so many of those problems is not necessarily smarter technology or better medications, but it's better care.
We're training senior nurse leaders, chief nursing officers from hospitals all around the country with this innovative mindset. They're learning about human-centered design, they're learning about equity-centered design, so that they can work with their health systems, with their teams, to be able to infuse that mindset throughout their institutions.
When you provide the right opportunity for nurses to excel, patients gain in every way.
My hope is that that would encourage more funders to look at nursing as an investment in not just the nursing profession, but in elevating our healthcare system and accelerating the improvement of our healthcare system.
Can we really deliver quality, sustainable healthcare at a systems level if we don't solve for some of these fundamental challenges in nursing?
Welcome to See You Now. I'm Shauna Butler. 1 penny. Can you believe that? Only a penny of every healthcare philanthropy dollar goes to nurses. If you're scratching your head wondering how that makes sense, you're not alone. Everyone has benefited from the expert care of nurses who are essential and indispensable to healthcare. Transformation of our complex healthcare systems requires vision, innovation, a commitment to long-term change, as well as substantial funding. Philanthropy will be crucial in creating and scaling positive change, which is why the American Nurses Foundation commissioned the first of its kind report to understand the landscape of philanthropic support for nurses and the nursing profession, and the need for funding sources beyond philanthropic dollars. In the third and final of our multi-episode series on investing in nurses, we bring you rare, in-depth, unscripted conversations with a nurse innovator, industry funder, and foundation executive director who are behind some of the creative, strategic, and evidence-based approaches to investing in nurses as leaders of care transformation and agents of system-level change and progress.
I'm Marion Leary. I am the Director of Innovation at the University of Pennsylvania School of Nursing. I also run the Johnson & Johnson Nurse Innovation Fellowship Program, which is a 1-year program for senior nurse leaders and chief nursing officers from around the country. I oversee our Innovation Accelerator program at Penn Nursing. I am one of the co-organizers of the Nurse Hack for Health, which is a global virtual nurse hackathon supported by Johnson & Johnson, SunCL, and Microsoft, along with a variety of other things related to innovation, storytelling, and equity-centered design.
I'm Howard Reid. I'm the global head of the Global Health Equity Organization at Johnson & Johnson. And there's really 2 parts to that. One is leading all of J&J's philanthropic efforts. So I lead the Johnson & Johnson Foundation. We have an impact investment fund focused on healthcare workers and health equity. And I also lead J&J's global public health efforts. So if you think about all of our efforts to create access to critical medicines in low and middle income countries. A lot of our work is in Africa and India. I'm also leading those efforts on behalf of J&J. Been at the company for almost 17 years, and we're all in on nursing. We love the profession.
Howard, where in the world are you today? Because you have a role that spans the globe, which means at any point in time, who knows what continent you could be on, right?
Yeah, today I'm sitting in Ambler, Pennsylvania. Next week, this time, I'll be sitting in Mumbai, India. So you're quite right. At any given time, I can be anywhere around the world focusing on health equity.
We hear about the challenges that workforces face, and I think you can probably confirm this, is that it's pretty much the same everywhere you go around the world. Our workforces are asked to do a lot with not the resources that they need. Oftentimes, those workplaces are described as being dangerous. They are dangerous. So we've got healthcare practitioners everywhere doing a lot of really incredible work under extraordinary stresses. But this work is kind of personal for you, from what I understand from your story. Can you share a little bit more about your experience, how this informs the way you approach your role?
For me, it's deeply personal. So I'm a first-generation American. My mother is from Jamaica, and she served as a community health nurse in the city of Rochester, New York, where I grew up. And I think the thing that really got me interested in healthcare was the story she would tell about how she served her community. Oftentimes, the stories are really challenging to hear, especially as a young child, to see some of the pervasive health inequities that were occurring in our community. But the thing that always struck me was how much pride she had and how important her work was day in and day out. Oftentimes during the holidays, families from around the community would deliver their ethnic foods or things that were really important to them as gifts to my mom based on the work she was doing to help them live healthier, happier lives. And I think it was that sparked my interest in healthcare. I saw how much the work meant to her, and I wanted to also pursue a career in that same space. So for me, it's deeply personal. It comes back to the conversations around the dinner table and the importance of delivering health to people that need it most.
There is a long-standing commitment that J&J has, a peerless, actually, commitment and investment to nurses and the nursing profession. Why don't you share that history and take us through where that takes us to today?
It really goes back to the roots of the company's founding, where a nurse named Elizabeth Washam was one of only two people who could sign off on the sterility of J&J bandages. This was really a trust mark. This was a symbol of trust that the doctors and nurses that were using their products were using quality products to help save patients' lives. Our support for nurses goes all the way back to the earliest days of the organization, and that's a commitment that's remained steadfast over the 120 plus years of our company's history. You know, the thing that's also really interesting, if you look at our credo, we have this document that highlights and outlines what's important to the organization. It helps inform how we make decisions as an organization. It's a document that is on the wall of almost every single meeting room across the global J&J organization. And nurses are actually called out in the first sentence of our credo. It's fascinating to see that this document, which is many, many decades old, calls out nursing and nurses as one of our most important commitments as an organization. And it also goes to show how the focus on nursing and nurses is really driving decision-making and is key to our purpose as we look to change the trajectory of human health.
Speak more about today, about the investment in nurses and nursing in light of a recent report that the American Nurses Foundation released called the Philanthropic Support for the Nursing Profession. So I'd love for you to talk a little bit more about where you are today currently as far as your thinking and your actual investing in nurses.
The thing that really stood out for me in the report was that only 1 penny out of every dollar from a philanthropic perspective was going to nursing, which is appalling. Nurses are at the core of many of these solutions, and they're uniquely qualified to help improve the quality of healthcare, advance health equity, and ultimately transform and continue to evolve healthcare. And that's really because nurses many times are at the heart of innovation. They're leaders in their workplace. They're clinical experts, advocates for patients, and so much more. So to see the dearth of funding and investment is something that absolutely has to change. Being in the community, and nurses often are the constant in their communities, educating patients and families and advocating for the care they need across the entire continuum. The fact that we aren't seeing enough financing and support for the profession is something that I know J&J is deeply committed to changing, but it's something that we need others to join us in to continue to move the profession forward. Our focus here at J&J has been to invest in a way that's relevant, targeted, and impactful, and also to recognize and appreciate that over the years, the needs of nurses have shifted, and how we support and champion nurses as a result has also needed to evolve. Over the past couple decades, we're really proud that we've invested well over $100 million in a variety of nursing initiatives that are all designed to spark interest in nursing, to recruit new nurses into the profession, as well as support and champion those currently in the profession so they can thrive, which is so important because if you're just filling the buckets with nurses and getting them interested in this amazing profession, but you're not focusing on their workplace and you're not focusing on helping them thrive, you're not really solving the problem.
One of the things that we've needed to focus on is having a representative workforce. And I'm thinking very specifically for you, Howard. You saw your mom. What does that message need to be so that a 15-year-old, a 14-year-old young Howard Reid, a young Black man, what does that messaging need to be that says, yeah, I want to be a nurse?
I think it needs to start with a message where people feel like they belong. Oftentimes, when younger people don't see themselves in the profession, they have questions whether or not they'll belong in that profession. So I think it starts with representation. I think it starts with this feeling of authentic belonging, number one. Secondly, 16-year-old Howard would want to know that this work was going to deliver on his purpose and passion. So telling the story on how nurses are impacting their community and the importance of the profession and delivering health for people in their communities is so incredibly important. And I think the third piece is people need to know that they have a future and that they can grow and progress in their career. So it's painting a picture of the full career arc and journey they can have as a nurse, taking on leadership opportunities, innovating within the profession. Leadership and career advancement has been a focus of J&J's for a long time in nursing. And it's really based on a really simple insight. It's that a thriving nurse workforce can better deliver patient care and ultimately improve health systems, which is really important to sustainable change. One of the examples in this space is the J&J Nurse Innovation Fellowship, powered by Penn Nursing and Wharton, which we're really proud to be a part of. And this particular program is different because it's team-based. And it focuses on powering up senior nurse leaders within health systems to drive transformative change in the healthcare work environment. And this partnership with Penn and Wharton, interestingly, focuses on design thinking, leadership, and change management. And we're super excited about this program because it's an opportunity to enable nurse leaders to be the catalyst for positive system-wide change, which is really what we're focusing on. We're looking at ways to have an enduring and sustainable impact. And I'd love to invite Marion to talk a bit more about the program as well.
We could not be doing this program without the support of Johnson & Johnson. Their leadership in pushing the profession of nursing forward and innovation in nursing forward has really been fundamental to the changes that we are seeing right now. We've known for a while that nurses are tremendous innovators. They are hungry to be able to solve for the problems that they're seeing and create these solutions to make patient care better. But you can only do so much from the ground up. You really need your leadership to buy in and support the work you're doing. And that's why the Nurse Innovation Fellowship is so important. So as Howard mentioned, we're training senior nurse leaders, chief nursing officers from hospitals all around the country with this innovative mindset. They're learning about human-centered design. They're learning about equity-centered design, leadership and business acumen skills through the lens of innovation so that they can work with their health systems, with their teams, to be able to infuse that mindset throughout their institutions. And it's that sort of mindset shift that will help to be able to support all of the nurses within their organizations to then be able to do these things. Nurses want to be able to innovate, but they don't get the resources, time away from the bedside, mentorship that they need to be able to do it. And mostly it's because leadership doesn't often understand what innovation means. Innovation is this really broad, nebulous term that means many things to many different people. And I think because of that, it has lost its impact. And so through this program, I've been able to see firsthand the transformation that has taken place with these senior nurse leaders, from being a little tentative about what we're teaching to being 100% in, where they're going back to their institutions and not only using what they're learning on the programs that they're creating for the Nurse Innovation Fellowship program, but using it for all of the work that they're doing back at their organizations. It has really been what we've expected in terms of if you teach it, they will start to use it and it will start to allow others in their organization to innovate and make change, which is really what we want. So we were really intentional about how we set this up. We knew we needed to have the chief nursing officer, but we also knew we needed to have another senior nurse leader who could help to, in this dyad, push through whatever innovative work that they were going to take on. But then the way the fellowship is set up is that it's both an in-person fellowship and a virtual fellowship. And for those virtual sessions, we invite the teams to bring all of the other individuals on their team to these virtual sessions so that they are learning all of the human-centered design, business, and leadership skills, along with the chief nursing officer and the other senior nurse leader. We know that innovation takes a team. We know that you're not going to be able to push an innovation agenda forward with just two people. We know that you need to have all of your other interdisciplinary colleagues on your team as well when you're creating an innovative solution within health and healthcare. And so we wanted to make sure that this was a team-based fellowship.
Howard was talking about looking at this globally. Another thing that has been supported by J&J, Microsoft, software developers, has been the hackathon. Why don't you say just a little bit more about what the hackathon is and why that investment in our current workforce solving today's problems is absolutely critical to career advancement and development, which then stabilizes the workforce and builds the capacity that we need.
Johnson & Johnson had supported an in-person hackathon back in 2019. And then, of course, the pandemic hit and everything had to go virtual. And so we really wanted to think about, now that we had to move to a virtual platform, how we could open this up to a global nursing workforce. Because we knew the pandemic was having the same issues all around the globe. And we wanted to give our colleagues around the world the opportunity to be able to innovate, work together, and create the solutions to the problems they were seeing. And so working with Sun Ciel, again, Johnson & Johnson, and Microsoft, we were able to create this virtual Nurse Hack for Health. For those who don't know what a hackathon is, it's generally an event that takes place over a weekend where you're bringing individuals together from all different sectors like IT, engineering, design, business, finance, and of course, healthcare, to pitch a problem, create a team, and work on a solution for that problem over a very short period of time, using human-centered design thinking, and other types of innovative resources. We have consistently had teams from all around the world working through their problems on these hackathons and working together with individuals from all around the globe. It's a great way to understand what other nurses are going through, and it's a great way to think differently about the problems and to start solving those problems through those different lenses.
So, Howard, when you survey the landscape, what type of investments, what type of gifts do you think have the greatest impact?
It's a really difficult question because there's a number of things to fix. So I think it has to be multi-pronged. Over the years, we've supported the profession in a variety of different areas. As Marion just talked through, nursing leadership and innovation. And we believe that programs that have the deepest impact are really well thought out, focused and targeted, take an innovative approach. And I think this is really important, that it's a multi-year effort. Oftentimes, you'll see an initiative or an effort that is launched, it makes a big splash, it's here today, and then before it has a chance to really take root and make an impact, it's gone. Especially when the work requires things like upskilling, which could take potentially years, or creating sustainable models of care, or as we talked about, thinking about how to actually improve the work environment to get nurses closer to the patient and the community. So these are things that require deep, enduring commitment. So I would say, number one, it has to be sustainable. It has to be enduring. It's also important that the investments motivate nurses to grow their careers and capabilities to drive progress. So balancing the individual growth in the form of scholarships with real systemic level approach to change is, I think, the levers that really drive impact. So two of the levers that we think are critical is, how do we attract them to the profession? And then how do we invest in helping them grow within the profession? Another key leverage point is representation in nursing. And back in 2020, J&J made a $100 million 5-year commitment called Our Race to Health Equity. And one of the key components in that commitment is scholarships to help attract diverse representative nurses into the profession. And we're incredibly proud of the programs and scholarships that we've been able to deploy to help drive representation. This point, it's quite close to home for me. My wife is a healthcare provider in the community, and she often talks about her ability to connect with her patients in a different way based on being culturally competent in their care.
You know, the numbers of times when I have heard people say that they walked into a room and said, "You're the first person I've ever had take care of me who looks like me." Yeah. What's that experience like?
It could be life-changing for the patient, because for many patients, it's the first time that they feel seen and that they can really start from a moment of trust with their healthcare provider. I truly believe that quality care starts in the community, and it's based on trust. And I think representation is really critical and key to that. Another key leverage point for us is the health and well-being of the workforce so that they can thrive. And we're incredibly proud to have a number of initiatives that are focused on supporting the workforce and the workplace, which is so incredibly important. So there's so many different things that we're looking to continue to do and invest in to not only attract nurses into the profession, but also help them grow and thrive.
In the American Nurses Foundation Philanthropic report, they listed several recommendations. What are your concerns if there's a continued delay or insufficient investment, or, as you mentioned, diving in with a splashy investment and then not being in it for the long term? If we don't make these investments, and on the more positive side, what's the promise? What's the best possible outcome when we do invest in nurses? My
major concern is that if we're not investing in nursing, are we really investing in quality healthcare? Can we really deliver quality, sustainable healthcare at a systems level if we don't solve for some of these fundamental challenges in nursing? And it's really shocking to see the lack of investment, because nearly every single patient and person that interacts with a healthcare system interacts with a nurse or a community health worker. So for me, the report is shining a light on the risk to us all based on the lack of investment in nursing. On the positive side, I think the one insight for me coming out of the report is really simple. We need more investment. We need more targeted, multi-year, sustainable investment. And we need to do it in a way that's strategically focused on those leverage points where we can drive the biggest impact. And it's so shocking to me because everyone should be invested in healthcare. And if we don't start to solve some of these challenges, we're not going to solve the problem at its root. So everybody should be interested in investing. Everybody should be invested in solving these problems for nurses. So I'm inviting everyone to take action, to take this on. This is some of the most important work we could do.
Howard Reid is the global head of the Global Health Equity Organization at Johnson & Johnson. Marion Leary serves as the Director of Innovation at the University of Pennsylvania School of Nursing. Building on Howard and Marion's calls for greater investment in nurses as system-level leaders, innovators, and change agents. Up next, we chat with an Enlightened Foundation Executive Director who sees investing in nurses and nursing not only as a good investment, but as the best way to elevate and accelerate improvement in our healthcare systems and better care.
I'm Ahrin Mishan. I'm the Executive Director of the Rita and Alex Hillman Foundation. We invest in advancing bold nursing-driven innovations that promote equitable, person-centered, and trustworthy care. We also invest in equipping next-generation nurse leaders, health leaders, really, with the knowledge and skill sets that will help them to lead change in healthcare and society. I love what I do, and I'm driven to do this work because I think that nursing is one of the great untapped resources in healthcare.
So, Ahrin, where's home for you?
I live in New York. Lucky to live sort of in between Central Park, which is this great oasis of calm, and a major hospital system. So I'm always reminded of the complexity of the world I live in and the importance of nurses and healthcare. So it's kind of cool.
So the Rita and Alex Hillman Foundation, who is Rita and Alex Hillman? Who are they? What have their lives been like?
Alex Hillman was a publisher, and he passed away in the mid-60s. And a year before his passing, he and his wife, Rita Hillman, established a foundation. And I think that there was a sense at that time that she had an only son, and he died 2 years prior to her husband's passing. And I think the idea was that a foundation would give her some reason to live in a way. And so, like many foundations, it was a sort of reflection of her many interests until the mid-'80s, late 80s, when there was this vast nursing crisis across the country. And it was particularly acute in New York City. And she had had a healthcare issue, went to the hospital, and came out with this epiphany that nurses are key to delivering not only quality care, but they're key to preserving a certain humanity. And that was this light bulb moment that changed the foundation and in many ways changed Rita Hillman's perspective on the world. And so starting in 1990, she directed the foundation's resources to trying to improve the quality of nursing care in New York City specifically. And it was kind of interesting because Rita and Alex were also art collectors. And on the walls of her apartment, she had a Picasso mother and child. And it was just this kind of amazing, take your breath away kind of painting. But after this experience in the hospital and this experience spending time in the presence of really smart, good nurses, she knew that it really wasn't doing anything on the wall of her apartment. And so she sold it and she directed those proceeds to establish the Hillman Scholars Program, which was a scholarship program that brought nurses to New York City in an effort to bolster our local nurse workforce.
It's interesting that epiphany, it actually takes having a very personal experience to understand nursing quality, the nursing excellence, the nursing science, the nursing practice for people to try to articulate it. We use this word very carelessly oftentimes when we say nursing quality. I would love for you to take a moment and explore that.
In some ways, this connects with a question I ask myself all the time, a question our board asks itself, which is why nursing? Why do we continue this investment in nursing when we could, for instance, switch to team-based care and other things? And I think there's this deep sense that I have that there are a lot of people who are hurting out there. There's lots of inequity. There's lots of injustice. And the key to solving so many of those problems is not necessarily smarter technology or better medications, but it's better care. And so when I think of nurse quality, I think of all of those things that I just mentioned that I think are really integral to delivering care that is not only effective, but is at the foundation of who we are as a society. And so I tend to think in these big terms, but that's why I find nursing compelling, is that nurses are integral to something that is so fundamentally human and such a fundamental piece of who we are. And so that's what drives us. That's what gets me excited about my job every day, is not so much these workforce issues, but nurses are key to not only better care, but who we are as human beings at our best.
So let's talk a little bit about your job. I have to say, on those days when I feel like I'm banging my head against the wall and people really don't understand what nurses do, what they can do, what they should be doing, I will just very quickly dip into your website because it's so boldly stated on the front page. We advance bold nursing-driven innovations that promote equitable, person-centered, and trustworthy care. How are you advancing these bold nurse-driven innovations?
Well, first of all, how lucky am I? I get to hang out with, number one, people who are way smarter than I am, and I get to hang out with nurses who I just, again, have this endless respect for. One of the things that I think is worth noting, going back to the history, is that when I took over stewardship close to 15 years ago, one of the things I wanted to do was to expand our reach so that we weren't just thinking about how do we serve New Yorkers better, but how could we address inequity and disparities across the country. One of the things that makes my job interesting and makes our foundation stand out is that I would say that nursing isn't necessarily our North Star. Addressing the needs of marginalized populations, that's our North Star. But nursing, we believe, is this amazing tool to address those needs. So one of the things that we focus on is trying to advance nursing-driven innovations that promote equitable, person-centered, and trustworthy care. And we've really taken to heart the need to invest in early-stage pre-evidence work. We think, how can we talk about innovation if we don't give nurses space to play and experiment? And so we have two programs. One focuses on everything other than serious illness and end of life, and the other program focuses just on serious illness and end of life, which we think is an area where nurses have an outsized impact. And we give 15 to 20 grants each year to nurses who may just have a really good idea and a really good execution plan, who want to try something out. And we feel that if I look at the landscape of philanthropy, there's a real lack of risk. People love to use the word innovation, but people aren't willing to put their funds, their support behind something that's kind of risky. But we believe in building ecosystems. And I would say adjacent to what I've described is this idea of building a community. We have relationships with grantees now that go back, 10 plus years. Some of the scholars that we invested in over a decade ago are now some of our grantees in those early development programs.
And when you're talking about investing in something that's risky, how does it feel to say it's something that is untested at this moment? Because oftentimes the things that we are doing are actually not super risky. We just don't know that they actually deliver the results that they hope to.
If the work is well designed, then I think it's often worthy of support. And if nothing else, it helps to accelerate the opening of pathways for other bold thinkers so that they know that pathway, there's nothing much down that road. On the other hand, we recognize that it's important for us to invest in work that, while it may not be risky, represents what we think of as a best-in-class approach. There might be a bunch of people out there working on the same thing, but somebody's doing it a little better, organizing their resources better, their methodology perhaps is a little sharper. And that kind of work also can have an enormous influence in sharing best practices across the field. So
can you give an example? Yeah, can you give an example of that?
I'm going to get some of the terminology wrong here. I've got so many different nurse interventions in my head, so I apologize. We have
Do not apologize. I will. I love the fact that you've got a lot of nurse interventions in your head. Keep them there and share them. Yeah.
No, and I should just say too that I'm in the midst of reading about 300 proposals right now for our programs in this year's cycle. So my head is full of all these brilliant nurse ideas. I'm thinking of one of our grantees, Sheridan Miyamoto, who created a better, more thoughtful approach to providing nurses who are working in remote settings with access to the kinds of technology, tools, and support so that they can provide care to survivors of sexual assault. So in, let's say, a rural hospital, there may not be anybody on that nurse team who has that expertise. But through telehealth and a proprietary technology that Sheridan and her team developed, they've created what we feel is a best-in-class approach to providing not only superior care, but a kind of technology that also helps to ensure that there's a greater likelihood that justice is achieved. So it's a beautiful example of nursing-driven design where Sheridan, as a nurse, is cognizant of all of the perspectives and factors that need to be considered in developing a holistic solution to a really difficult problem. Even though we don't invest in addressing workforce issues, but our investment in safety and Sheridan's intervention, we understand that it has an impact on helping to bolster retention amongst nurses working in rural settings. And I think that there's one of the things that I think is really important is that as funders, even if we have different areas of interest, it's so important that we come together and recognize that we work as part of a shared ecosystem. And when we can see those areas of integration, I think that's important. The Arthur Vining Davis Foundations, for instance, learned about our investments in new early stage nursing-driven innovations in the serious illness end of life space. And rather than create a new program, they just felt that it was better to expand our program. So we've had this remarkable partnership with them. I think they're a really forward-thinking philanthropy in that way. So encouraging our philanthropic community to embrace the importance of a return to nursing as a really important area to invest in and to develop.
When you talk about investing in nurses, your experience with nurses and your understanding of nursing science, nursing practice, nursing innovation, you see very clearly that in your mission to address social justice, poverty alleviation, human dignity, health equity, racial issues, it feels like the more you are exposed to nurses and their practice and the way they care for people, the ethics that they are driven by, that this is really our best vehicle, our best set of talent, our best set of practices to address many of those issues. That's what I feel like I'm hearing from you.
Yeah, someone once said that nurses practice where others don't or where others won't. And in some ways, I feel like we feel a responsibility to be there to work alongside those nurses. We know that we're just funders, and we're not out there doing the hard work in the field, but nurses who are practicing in areas and communities that are outside the reach of mainstream healthcare, and to some extent, perhaps outside the financial interests of mainstream healthcare, I think that work is incredibly important. And in looking at our grants, while we do fund lots of acute care settings, for instance, a lot of what we do is very community-based and work that nurses do in concert with community rather than sort of working for community. That co-owned, co-designed approach has also been something that's really key to the kind of innovative work that we've funded. I am so struck on a daily basis by nursing's capacity to function as an agent of change. And one of the things that just drives me nuts is that nursing remains one of the great untapped resources in healthcare. So you've got all of this amazing perspective, all of this boots on the ground perspective on what patients and communities need, and it's not being tapped into and it's not being harnessed. So I think we have to move beyond seeing nurses as secondary to physicians, as facilitators of change, and we have to see them as leaders of change. Sometimes the most profound innovation can be a subtle shift in how a clinician and a patient communicate. Being able to broker trust can be the difference between substandard care and something that can transform somebody's engagement with their own healthcare and engagement with the healthcare system. So we have a grantee, a program called Team Birth. The PI is Amber Weisseth, and it's a intervention that was developed at Ariadne Labs in Boston. What I love about it is that it's really simple. It's really cost effective. The only piece of technology that is involved is one of those erasable whiteboards that goes up in a birthing room. And it centers the voice of the patient, the birthing person, and helps to organize and optimize communication between clinicians and birthing people. Nurses are central in brokering that relationship. And what we're seeing is that it improves outcomes, it improves the experience. It also resonates beyond, so that people who have those good experiences feel better about looking into their health and talking with clinicians. I think that that's huge. I have to say, too, Team Birth has, in the last, I think, 3 or 4 years, scaled incredibly rapidly. It's now in over 150 hospitals around the country, which tells me there's also real demand for an innovation that is not a technological innovation, but is an innovation in trust. It's an innovation in communication. And that I get really excited about, because that's an area where I feel like nurses own that territory.
Yeah.
And we need to harness that nurse knowledge, much more effectively than we do currently.
Yeah, I was thinking about some of the things that you've said about funders. And so in the American Nurses Foundation report titled The Philanthropic Support for the Nursing Profession, it confirmed what I suspected, but it was still discouraging to see that, nurses are not getting the funding that is required in order for us as communities, as countries, as citizens to get the healthcare that we all deserve, that we need, that we desire. When you read through the report, what were some of the things that really stood out to you?
So, I think, Shauna, that you and I were probably both struck by what it was at the 1% figure. And I think I was also struck by, in terms of, for instance, the work that we focus on. That represents an even smaller amount, right? That's not even a penny. That's like a quarter of a penny or something along those lines. Less than 10 years ago, there were more funders who invested in nursing specifically. And I think that I understand the shift that took place, and people felt like there were too many silos, and I'm against silos. So I understand a move toward team-based care and interdisciplinary care. At the same time, when you have such a remarkably untapped resource, it deserves additional attention. I hope that more philanthropists and philanthropies can look at nursing a little more expansively and creatively, so that they understand when they invest in nursing, they're not investing in nursing at the exclusion of other health professions or other issues. By helping nurses to innovate, by strengthening the nursing workforce, it has this resonant effect. It echoes throughout the entire ecosystem. My hope is that that would encourage more funders to look at nursing as an investment in not just the nursing profession, but in elevating our healthcare system and accelerating the improvement of our healthcare system.
Yeah. In that report, some of the findings is that nurses are the key to the most cost-effective, higher quality, more equitable healthcare for all. And health equity will only be achieved with nurse leadership. The report identified so little is invested in the workforce, next to nothing in leadership, nurses as leaders. And as leaders, that's really as innovators. You want to talk about some of the investments, the projects, the gifts that you've been involved in that you feel like have made the greatest impact?
When I think about what our contributions are, we've got lots of really amazing individual programs. But the bigger contribution, I think, from our end is that we've created opportunities for nurses to experiment, to try new things. I think that those investments in pre-evidence, early stage, nascent work is really key to developing a healthy ecosystem of innovation. I think we've contributed to subtle shifts in the broader culture of nursing and how nurses see themselves. One of the things we wanted to do really early on was to get nurses to move beyond this idea that they're masters of the quick fix. I've always found that master of the quick fix sort of, it's a backhanded compliment in a way, because it diminishes the innovation that's involved. And it also says, well, you're good in a pinch, right? You can MacGyver that, but the big systemic stuff, leave that to
the professionals.
Right, exactly. And so it's been really important to us, for the last 15 years to try to contribute to changing that mindset, both outside of nursing, but also within nursing. So one of the things that I think, in addition to advancing nursing-driven innovations, that has been important has been trying to provide nurses with the knowledge and skill sets that help them to think of themselves as designers of change and position their work for broader systemic influence. For years, we were looking for the right partner to develop a hands-on curriculum that could teach design thinking skills and human-centered design to nurses across a variety of settings. So not just nurses in academic settings, but also clinical nurses working in small FQHCs in rural settings, as well as major metropolitan hospitals. And eventually, we had the great good fortune to meet Marion Leary at University of Pennsylvania. But we, together with her leadership, developed something called Design Thinking for Health, which to my knowledge is the first of its kind digital platform that presents design thinking in a way that can be used by nurses across the full spectrum of care.
I think that the vast majority of the users of this, free for anyone, open to the public, not exclusive just to nurses, anybody who wants to go and use it, but the numbers of nurses, middle career, late in their career, very seasoned, who use this tool, the Design Thinking for Health, it's remarkable. Its reach is incredible. And the other part that I love about this platform is that it's nurses who are teaching the design thinking. It shows their skill in being able to do this as designers.
One of the things that I think is really cool about how nurses experience that platform is that when they look at the methodology, I think that so many nurses recognize that this is kind of what nurses do really well. And so one of the things that I hope a nurse realizes when they look through the Design Thinking for Health platform is I'm already doing a lot of this. And it helps to bolster the confidence that, yeah, actually, I am capable of not just the quick fix, but designing a totally different system. So we think of Design Thinking for Health as this tool that helps to accelerate the pathway to a new innovation and advancing improvement in healthcare. There's a designing for equity component that we've added that I think is really critical. So super proud of that effort and super privileged to be working with Marion. So when I think about that ANF report on philanthropy and the sort of small amount that is going to leadership, one of the things that I think is really important is thinking about the type of leadership that other philanthropies are investing in. And there's a big difference between teaching someone to be a nurse manager and teaching somebody to lead for change. And so the leading for change, I think, is super important. And so I really admire the work of Johnson & Johnson, for instance. They have the J&J Innovation Fellowship Program, which really looks at positioning nurse leaders, I think kind of CNO level, senior nurse executives, to position them not just to advance within their organization, but it's positioning them to lead for change and to think with this innovative mindset. It actually means a lot in the field at large when an organization like J&J gets behind that kind of message too, which is it's not just about a kind of generic approach to nurse leadership, but it's saying nurses should be innovators and leaders of change. I think that's really significant because it says there's a kind of culture shift. The thing that I think is really special about the J&J program is that they're big enough that when they frame their effort around positioning nurses to lead for change, policymakers listen and people leading health systems listen in a way that they might not to us, because even though we're doing really, really amazing work, we're pretty small. And I love when organizations, bigger organizations that are kind of name brands, get behind nursing. When they invest in nurses, that's really powerful. So that's what I want to see more of. That's one thing that we also are looking to do more of, is to how do we bring in more partners to do this work? Because we care about a better healthcare system, a better society.
Can you speak more to the personalized support, the strong partnerships, probably in the context of how you're investing, and then where that personalized support and strong partnerships come into play?
Sure. We have a Hillman Scholars Program, which is a integrated BSN to PhD program, which is really meant to equip young, talented nurses with the skill sets that they need to advance and lead change. Then we have our suite of programs that advance nursing-driven innovations that address the needs of marginalized communities. We have 2 early-stage development programs. One is the Hillman Emergent Innovation, and the other is the Hillman Emergent Innovation Serious Illness End of Life program. And that's where we make our investments in early stage, pre-evidence, nascent work. The next program in that pipeline is a program called Innovations in Care. And this is where we position work that has a compelling track record and shows real promise to have impact on a broad scale. From a grant dollar perspective, that's our largest program. And at the end of the pipeline, we have a program called Innovation Dissemination. And that's where we help work that is already well established, that has a very strong evidence base, to work through issues that might be impeding their scaling efforts. We approach our relationships kind of like the way nurses approach their relationships with patients and communities. What do you need? We don't have a one-size-fits-all approach, but we work in partnership with our grantees with a shared mission to make things better. And so we're on totally an equal footing, and I would argue we look up to them. So I love the fact that we have been able to break some of the cultural constraints around the grantee philanthropy relationship. So now some of the people that we funded are also some of the people we trust most to tell us when we're a little off base and what we can do better. And that is what we think of as a vibrant, healthy community and ecosystem. And we just want more of that. So we would love if you're doing interesting work, and we're interested in the work that comes from nurse scientists and nurse researchers, but we're also really interested in the sort of work that's being done at the grassroots level. We believe that innovation and really good ideas can emerge in a wide variety of settings, not just the halls of academia, not just major academic medical centers, but also in small community centers, nurse-managed clinics, et cetera. So we invite nurses who are trying to change how care is provided and who are trying to change the relationship between healthcare providers and communities, who are trying to narrow gaps in health equity. Go to www.rahf.org and look at our programs. We want to hear from you because we'll learn from you, and we see ourselves as partners in this shared effort to make healthcare more trustworthy and more equitable. So fingers crossed that we'll see some more applications. And I would encourage people who visit our site, in addition to looking at how you apply, look at our grantees and look at the kinds of programs that we've invested in over the years. And I think you'll see this commitment to not only advancing innovative nursing-driven work, but also kind of developing this more diverse ecosystem. I hope there are philanthropists out there and philanthropies who are thinking about nursing as a potential area of grant-making focus. I hope they're listening when I say it's kind of a no-brainer. And I think it's really important.
Gosh, Ahrin, you make such a strong case for why we should be investing in nurses and nursing. And your humility and honesty and reflection on all of this is wildly refreshing. This seems really personal for you. Is that true? Is there something there that you might want to share?
Nurses are kind of my heroes just because they're like pretty good role models for how to lead a good life. So the Lillian Walds, the Mary Seacoles, the Dorothea Dixes, these figures, they're part of my pantheon of heroes. My daughter, who's now 15, has grown up with me going on and on about nurses are the real heroes, right? And a number of years ago, back when she was probably 11, I was invited to give a commencement speech at a nursing school. And before I left, my daughter essentially said to me, I think they made a bad choice in their commencement speaker.
Only a child would give you that ruthless feedback.
It was totally ruthless, but she said it with a smile, and so I tried to be cool, and I said, well, like, why? And she said, yeah, you know a lot about nurses and nursing, but you're not a nurse. And she went on to explain that the nursing school where I was going to give the commencement speech was kind of like Hogwarts, and the nursing graduates were sort of like the wizards. And essentially she was saying I was a muggle, and that I just didn't belong and I wasn't worthy. And it was a kind of brilliant explanation. And I kind of thought about it, and I thought, yeah, that kind of hurts, but I sort of agree with her too. So I like the place where I'm at, which is I like being in a position of support, but I know the difference between the work that I do and that the foundation does as a supporter of these efforts and the real work, the real hard work, the real important work that nurses are doing.
Special thanks to our episode guests, Ahrin Mishan, Executive Director of the Rita and Alex Hillman Foundation, Marion Leary, a nurse of many talents who wears many hats and serves as the Director of Innovation at the University of Pennsylvania School of Nursing, Howard Reid, Global Head of the Global Health Equity Organization at Johnson & Johnson. And we started off our series and this episode with insights from Kate Judge, who is the recent Executive Director of the American Nurses Foundation, who commissioned the first ever report on philanthropic support for the nursing profession. We invite and encourage you to listen to and share each episode in this series. 106, Investing in Nurses, Insights in Action, and 107, Investing in Nurses, A Nurse's Journey. As we've heard throughout the Investing in Nurses series, the stakes are incredibly high. The need is enormous and growing. Investments are woefully insufficient and overdue. And there are so many creative, strategic, and evidence-supported ways to invest in, elevate, and champion nurses that benefit the health of everyone on the planet, and even the planet. And nurses are most definitely worth way more than a penny. The crisis healthcare faces with regards to the growing demand for nursing care is not new. For decades, nurses have been calling attention to, begging, screaming, some might say, about the substantial funding from all sources needed to build, support, and sustain the diverse, representative nursing workforce and leadership necessary to meet every community's growing and changing health and care needs. The COVID pandemic brought parts of this reality to broader public attention. Yet, despite awareness of the many critical roles that nurses fill and their vast responsibility for health outcomes, few funders seem to view nurses as essential contributors to care delivery transformation, system-level leaders and change agents, and instead focus on training new nurses rather than addressing the systemic factors and workplace issues that lead to nurse attrition. As Kate Judge reflects in our first episode, if you look at all the dollars that are given in healthcare and imagine what if 20% of that went to nursing, it would be mind-boggling. Let's close with a key insight from the ANF report that nicely summarizes what we've heard and learned in these conversations with funders, philanthropists, investors, and innovators. Nurses are the key to more cost-effective, higher quality, more equitable healthcare for all. We must focus our philanthropic resources where they can make the greatest difference by investing in nurses. We hope this report prompts action and wise investment. The health of our nations depend on it. For See You Now, I'm Shauna Butler. Thanks for listening and for investing in nurses.
Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation. Nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource, our nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.